6 or 7 years ago, I correctly predicted that the role of the physician as the principal provider of healthcare was in danger. Over the ensuing years, hospitals have continued to benefit from the expanding role of paraprofessionals and from the top-level professional degree, the doctorate, that those paraprofessionals are obtaining. Witness, for example, the inroads that CRNAs have made in their push to be recognized as equivalent to anesthesiologists. Hospitals seeking to break the financial and medical staff voting block of anesthesia groups are more often willing to accept CRNAs in place of anesthesiologists. They view them as cheaper, more controllable, and unfortunately disposable. Many of my blog readers push back, saying that they weren't anesthesiologists or CRNAs, so what? It didn't affect them. That's short-sighted thinking. I recently came across an article that describes a hospital's move to replace its physician hospitalists with physician assistants, PAs. Why? Because they're cheaper. In the words of a patient who was portrayed as not being bothered that a physician assistant was, in essence, in charge of her care, the PAs, quote, seem knowledgeable and they're easy to talk to. I feel comfortable with them. Easy to talk to tells you something about your need to relate to patients, but seems knowledgeable is by no means equivalent to is knowledgeable. If it were, hospitals might then simply hire out-of-work actors from their day jobs, bussing tables at a restaurant near you to play physicians of all sorts. They'd seem really, really knowledgeable. At the same time as paraprofessionals are pushing for more authority, doctorate degrees are becoming the top professional degree in many of their fields. Once the nurse specialist performing your function becomes a doctor, you will become irrelevant, or so goes the thinking of hospital-centric healthcare pundits. Physicians do have one important branding tool, the MD degree. Of course, as paraprofessionals become branded as doctors, too, the value of an MD will become diluted. Physicians can't allow that to happen, and your professional societies must take a far more active role to educate the public on the difference between MD-delivered medical care and the care delivered by nurses and other physician extenders holding doctorates. I'm not denigrating the role that nurses in general and CRNAs and PAs and other paraprofessionals play. Rather, I'm asserting that if there's not an actual distinction in the difference between their education, skills, and training and those of physicians, then medical school and residency is a scam. I don't believe that for a second, but who might? Additionally, physician specialty boards, which to the public are generally meaningless. After all, what do all those initials after a physician's name really mean? Must devote significant resources to promoting the public's awareness of the high level of training and peer-reviewed expertise required in order to earn that designation, and even more importantly, what that actually means to patients and to their families. It's bizarrely amusing in a sixth sense to see hospitals demanding that all physicians in a contracted group operating a hospital-based department be board certified, while at the same time happily replacing a significant portion of those same doctors with far lesser trained nurses and other paraprofessionals. Still don't think you should be worried? Well, consider this. A few weeks ago, I had a conversation with a CRNA who's afraid that they'll be replaced with AAs, anesthesiologist assistants. Hey, who even needs a nursing degree? For complimentary resources, including articles and our monthly newsletter, the Advisory E-Alert, visit advisorylawgroup.com.